let's cross from Lagos to Abuja. They say as a crow flies, and in the Federal Capital Territory, we have Dr. Adedeji Koka, who is a medical practitioner. Great to have you join us on NEWSHUB on this World AIDS Day.
Good morning, and thank you for having me on your platform.
Excellent. And I'm sure you've been following the discussion on this three-way traffic with the resident doctors vice president in Enugu, in Lagos, Patrick Akman, who's coordinator network of people who are living with HIV and AIDS for 15 years. He's lived with virus and has been a survivor, so they say. But tell us what you can add, your opening statement on this World AIDS Day from Federal Capital Territory, the things which you've seen in the field and the things which inspire your confidence and the things which also raise your concerns.
Okay, it's been a very interesting discussion so far. I actually had some experience with a non-governmental organization, AIDS Healthcare Foundation, which as a benefactor treated a lot of people in Abuja here, in a certain part of Abuja with AIDS, living with AIDS. So I had a bit of exposure into the challenges as a country for people living with AIDS. Thankfully, a lot of the treatment for people living with AIDS is subsidized. Okay, so they really don't have to pay much to access treatment, appropriate treatment for all of these things. But I think one area that Nigeria still lacks is the access to specialist care. Okay, because some people still live with HIV, okay, and the antiretroviral treatment has been sufficient enough to manage them. Unfortunately, there are still a very small number of people who move on to AIDS, which is a more complicated form of the disease. Now, those people would need specialist care, depending on what kind of complication they come down with. If they need a respiratory physician, if they need a neurologist and all of that. Now that is one aspect in Nigeria I think we still have not been able to overcome with regards to caring for people with HIV/AIDS.
People that need specialist care. Can you shed more light on that?
Okay, so HIV/AIDS is actually a spectrum of an illness with different outcomes. It starts with HIV, which starts with the acute illness. Okay, usually those people really don't come down with any major illnesses at all. They might have some flu-like illnesses. Some people even attribute it to malaria, for example, and then that passes. Now, if those kind of people do not have access to antiretroviral treatment, eventually that spectrum continues down the line and leads to AIDS. This could happen over a period of between 8 to 20 years, okay? But then when they do come down with AIDS, then AIDS itself is by definition a very severe illness, okay? And there are specific classifications for AIDS. They might come down with chest infections, they might come down with infections in the brain, they might come down with other severe infections. Now, these are not infections that can just be treated at the regular outpatient department, for example, or at a primary health center somewhere in Gwagwalada, for example. Okay, these are people that are severely ill, would need to be admitted, sometimes even into the intensive care unit, and would need specialist care. Now, this is an area that hasn't been addressed adequately in the Nigerian health sector.
And I'm thinking of those numbers, Dr. Koka.
Yes.
Look at the numbers of medical doctors we've got in the country. 3.8 to I think it's 3.8 to 10,000 we have, and which is by far less than what you get in any of the OECDs. Would you say that this is surmountable because, speaking from a medical doctor point of view, which you speak, you realize that several doctors are on their way out of the country rather than into the country. So
yeah.
How do we get out of this?
Actually, right now, it doesn't look promising, to be honest, because as they say, there are a lot of doctors looking towards shores beyond to improve their practice, to improve their lives. Okay, but I think Nigeria needs to get back to the basics of it. First of all, I think if the national health insurance coverage is a lot wider, and more considerate for people who have complicated illnesses, then it's more inclusive to the basic man on the road. Having in mind that HIV/AIDS is actually... Hello.
I'm sorry, Dejikoka, I will get back to you in a bit. We're still discussing World AIDS Day. It's global responsibility. Let's see how we all can get it out of the world system. Who knows, by the year 2030. We'll take this very short break. We'll be right back because we have Mr. Akpan in the studios as well as the doctor on the other side. We'll be back in a bit. That's Dr. Ejiofor. We'll be back in a moment. It's the World AIDS Day, December 1, 2020, and if COVID-19 is around, we're taking a look at how we can get AIDS and HIV out of the system. If the 2020 mark has been missed, let's see how we can go about it. Well, in the studios, we have Mr. Patrick Akpan, the coordinator, state coordinator of Network of People Living with HIV in Lagos. Thank you very much for being part of it. We hear you have a program you have to attend to. It is your day anyway, so you want to thank you very much for sharing your time and thought with us on the program.
Thank you.
Thank you so much.
Thank you.
Thank you. All right, so let's take it back to Dr. Ejiofor at this point in time. We've heard that people still are holding back not only to their statuses, but also getting treatment, even though in some states, for instance, in Lagos, Mr. Akpan told us a while ago, it's as good as free. Why do you think people are doing this, aside what Mr. Akpan told us earlier?
Sorry, I didn't get the question, brother.
Okay, we're saying that why do you think, from your experience, you've been working with a lot of patients, what are the reasons they've given you that they're running away from treatment? Because if they don't get treated, then the virus is bound to spread around and they may also die.
Okay, first of all, when something bad happens to a human being, I'm not saying that HIV is good or bad, but okay, for example, when someone dies, there's the initial disbelief and even denial. It takes quite a while for someone to pick himself up and go for treatment. But I had initially mentioned depression as an entity, which is very significant and very important in the management of these patients. Many of them end up being very depressed, and even to get out of bed will be a problem, coupled with the stigmatization, what the family will think, for the married ones, what the spouses will think, for those with children, what the children will think. In fact, some might think it curses from their forefathers as usual. You know how we behave as Africans sometimes. So it's something that I guess it's being studied now at this point in time. Depression in HIV. Depression is real. Nigeria is not a wonderful place to be. Then you bring HIV again into somebody's life. Life is difficult already. And it's still one person, it's still one body. It's quite difficult, really. And that is why today is very important. That support for people living with HIV is very important. They are not alone. We have to continually remind them, thanks to the person that started this in 1987, we have to keep at it and tell people to keep marching, keep taking their drugs, and let's be hopeful with science in finding a way to stop and end this global epidemic.
For every time we have to discuss any of the days, whether it's World Malaria Day or HIV or any health-related subject, it gives us the opportunity also, apart from to raise awareness, also means that we have also the opportunity to look at the country's overall healthcare indices and picture in a more holistic way, because people often argue that many of the problems we face, whether it's with HIV and AIDS or malaria or tuberculosis, is symptomatic of the problems we face with the country's overall healthcare system. In terms of access to healthcare for the everyday man and woman on the streets, what are the pertinent questions you think that we need to ask, not just the health practitioners, but also policy makers, in ensuring that everyone has equal access to healthcare in the country?
Okay, thank you very much for your question. A lot still needs to be done in terms of formation, legislation, and implementation of policies in the country, along with the things that are going wrong when you look at the Nigerian health institution. I have talked so much about the health financing, which is below 4% when it should be 16%, and we have very limited expenditure on health, but a few philanthropists are doing their best. You mentioned the health system, and that has to do with for the physician density. The physician density in this country is still largely depleted. You know, we say brain drain, yes, but I mean, you ask yourself, why do people really go out of the country? People go out to have a better life, for better remunerations. If you're looking at just doctors, you would be surprised at how many nurses and midwives have left this country too. It's quite astronomical. And in fact, where I work, consultants have left for Saudi and even for UK. These are people at the top of their jobs. These are Nigerian trained professionals. And I'm sure that is why this is called a brain drain. It's quite a pity that these two
round from the program. Now, let's get back to our Abuja studios and speak with Dr. Ayodeji Coker, who's right there. Dr. Ayodeji Coker, the world has been battling with HIV/AIDS for some years now, and then in 2019 to 2020, coronavirus hit us so hard. Over 200 countries have reported the presence of coronavirus in their countries. As we speak right now, we hear that some governments across the nations have begun to divert funds meant to take care of HIV and perhaps AIDS into combating COVID-19. What impact do you think this would have on the fight against HIV/AIDS in the countries, especially Nigeria?
Over the COVID-19 pandemic, we would circle back around to battling the HIV/AIDS pandemic, because there would be a surge in the HIV/AIDS pandemic. Some might argue that, of course, with the tenets of managing COVID-19, such as self-isolation and social distancing, there might be some reduction, hopefully, in the most commonest means of spreading HIV/AIDS, which is through sexual intercourse. But eventually, I think we would come back to battle another boom in the HIV/AIDS pandemic. And that's why I think policies are very important for dealing with things like this. If there's a policy, a clearly stated policy, and with the attached funding for HIV/AIDS, then there's no reason why a government would then divert the funds for that towards another disease, because another policy with different funding should be established for COVID-19, irrespective of HIV/AIDS.
We must clarify that this has not been established in Nigeria. It's actually just a general question which we have to answer all over, since it's a global effort towards ending HIV. However, now let's take it. I asked a question. We put a question across to Dr. Ejiofor earlier on the mother to child transmission of HIV in the country? You take care of a lot of people in Abuja. What would you consider to be the highest point of your experience with mother to child transmission? How prevalent has it been? And what is the government and perhaps private health givers doing to ensure that this is really curtailed on time?
Maybe vertical transmission, that is mother to child transmission, is not as common. I think unfortunately it is quite common in Nigeria. I've seen it a lot with a lot of children eventually being diagnosed with HIV AIDS eventually, and that is really heartbreaking to disclose that kind of news to a mother who's been hoping for over 18 months since the delivery of the child that hopefully by some chance the child isn't diagnosed with HIV AIDS. So I think a lot of things need to be put in place. One of them is encouraging exclusive breastfeeding. We live in a country where we can't afford to give subsidized breastfeeding, subsidized breast milk, such as the other feeds, NAN and the rest, to babies, which would actually reduce the risk of transmitting through breast milk. So in our country, which is a low resource setting, we've encouraged exclusive breastfeeding, as well as early diagnosis and treatment. Once a mother has been diagnosed with HIV AIDS, then we do not delay commencing antiretroviral therapy, and then we try to even incentivize her staying on treatment, so that hopefully by the time she's delivering this baby, the viral load is low and the risk of transmission to the baby is even lower subsequently.
Dr. Coker, Patrick Akpan is out of the studio, but a lot of things he said, giving us a view into the lives of people who are living with HIV and AIDS and the challenges they face, makes me think about many things, not exactly, yes, we've made strides, but it appears that several people, this 1.8 billion people who are living with HIV and AIDS in this country, being left out of a major part of what we can achieve with them. Not all of them can be like Patrick, who is now an activist and demanding for rights and ensuring that through his network, people who are living with HIV and AIDS can have a better life. A large number of them remain in the dark, and stigma remains a big problem for many of them. What do you think in terms of shared responsibilities away from the clinic and the hospitals, what they have to deal with people who are living with HIV and AIDS, and how this can be a lot easier for them and move to the next stage in terms of what we can do with them?
So I think we need to take the message to the people. In other words, instead of mostly sitting in consulting rooms, staying in the hospitals, we need to do a lot more community outreach. There's still a lot of stigma, and you mentioned those figures on people living with HIV/AIDS in Nigeria, but I can guarantee you there are a lot more people than those diagnosed living with HIV/AIDS in Nigeria, because the stigma is still a very common thing here. But if we're able to take the message to the people in the communities, we do a lot of community outreach and organizations, and this is shared both, the responsibility shared both by the government and non-governmental organizations, then we're able to sensitize people and make them understand being diagnosed with HIV/AIDS is not a death sentence. Okay, there's treatments that could prolong their life. There's treatments that would make them live an almost normal life. The examples of people who have successfully been managed on antiretroviral therapy. And if people who are also within our communities, who are relatable to us, can also come out and tell their stories of how they were diagnosed with HIV/AIDS and have made it so far, so long, then it becomes more relatable, it becomes more common, and then seen just by the next person next door, and then people are more comfortable getting tested early, and then with that we are able to prevent the disease burden eventually.
Let's speak as we custom. Let's speak with Dr. Ejiofor at this point in time. The 2020 World AIDS Day. Oh, okay, sorry. Okay, let's stick with you, Dr. Ayodeji. The 2020 World AIDS Day is geared towards ending HIV/AIDS, let's say by the year 2030, which will be in conformity with the Sustainable Goals Development, that's SDGs. How close are we to achieving this? If you put into consideration the availability of health services we have in the country, the health givers, the patients, the drugs, and every other factor?
I'm not sure. Not to sound too pessimistic, but I'm not sure that would be achievable by then, because we still have a lot of people who are untested. We still have a lot of people who are unwilling to be tested because the stigma is still a lot. I think the stigma is a very major hurdle that if we're able to get over, then it becomes easier to face this. But on the other side of getting over the stigma is funding, enough funding to ensure that everybody who is tested and tests positive eventually starts treatment and also stays on treatment. I mentioned earlier that I worked with AIDS Healthcare Foundation, which basically subsidized care for HIV/AIDS patients, such that they didn't even have to pay a penny for treatment. Now they went further to even incentivize it, such that people would be given monthly stipends if they came regularly to make sure that they were taking their drugs for HIV/AIDS. So I think on one side is the stigma, and on the other side is enough cooperation, government and private partnership cooperation, as well as funding to overcome this disease burden. But as at right now, I don't think we're doing quite a good job of any of these, whether fighting the stigma or funding to cover all of the necessary things with regards to taking care of people who have been diagnosed with HIV/AIDS.
And is it not worrisome knowing that most of the funding for HIV/AIDS come from foreign donors, from international donors? Do you think within the Nigerian health sector that the government is doing enough, taking into consideration the money budgeted for the health sector itself, talk less the money is needed to take care of HIV/AIDS patients alone as an isolated case? What other things would you think government should be doing to ensure that, let's say, foreign AIDS, to take care of HIV/AIDS stops today? How do we as a nation, where do we stand in being able to provide healthcare for our citizens?
So if we're being honest with ourselves, I think we do not have the appropriate funding as a country to take care of people with HIV/AIDS. So if that is established, then we know that we have to seek outside, okay? And that has to do with a lot of international organizations, seeking for funds from a lot of international organizations. Unfortunately, we're in the era where we've been hit with another pandemic, COVID. So a lot of attention has been diverted towards that. But it does not mean we can't still continue to press and seek help from these donors. Hopefully with adequate funding, then things would get a lot easier for Nigeria in terms of this fight. Generally speaking, zooming out of HIV/AIDS, Nigeria's health budget, I think, if I'm not wrong, for the last year was less than 10%. And I think WHO had actually stipulated for most countries to have a health budget of at least 10% of the total annual budgets to be able to actually say you are serious about fighting a lot of health issues that your country faces. So if our health budget is considerably less, then I don't think we're at the point where we are serious about our health status as a country.
The country's health credentials not anything to write home about, still far from where it should be. And thankfully, those which you mentioned, the reason why we've had successes is the free antiretroviral treatment, which is available for several thousands of people, which is why we've had successes, reduced viral load suppression and an increased immune system. But Dr. Coker, the idea of the program, of course, is to help and inspire people to know that it's not a death sentence, and people who are living with HIV and AIDS can have a healthy life and go on to achieve whatever the dreams and ambitions are in this country. What would you say on this, as we bring the discussion to a close on World AIDS Day, if you are going to talk to one person today on what it is and how it is to live a life free of HIV and AIDS, or if you have HIV and AIDS, to still realize your dreams and ambition?
So I'd say for those who unfortunately have been diagnosed with HIV/AIDS, there's still hope. It's not a death sentence, as you said earlier. As long as we stick with the antiretroviral treatment, as long as we are judicious with its use, as long as we seek early health interventions in cases where unfortunately you might have come down with some other infection. I think those people largely would usually live a normal life, will be able to reproduce. They can chase whatever ambitions in their works of establishment. Okay, so there's really no limitation. Now, for those who don't know their status, I'd encourage every one of you to get tested. Get tested. Getting tested early is one of the keys towards preventing AIDS eventually manifesting, and that decreases our burden. And also, by decreasing the burden, then we help Nigeria as a country, because less money is needed to actually focus on AIDS, and then that loses up more money for other things in the health sector that we need to take care of. The general tenets of preventing